Hello everybody, this is Dr. Haley again. I'm a Sports and Performance Chiropractor located in Bergen County, New Jersey. More specifically Lyndhurst, New Jersey. We're just a few miles outside of New York City and just 2 miles from the Meadowlands Sports Complex. Today's topic is low back pain. Why do people get it and what can you do about it? I'm going to go over some of the causes, some of the ways you can prevent this. Do you realize millions of people suffer from low back problems each year? And you probably know 1 or 2 people, and it might even be yourself, that had 1, 2, 3 back attacks throughout their life. What causes this? Now sometimes it could just be muscle tension that lasts a few days and goes away. Sometimes it could be really debilitating. And all interventions can't help, and some people need surgery. So what we want to do in our premise is to try to prevent this from happening. But before we can do that, you have to understand a little bit about lumbar or spinal anatomy. And I'm going to use a couple models to demonstrate that. This model right here is the little miniature spine. This is a scaled down version of the spine we use in the office to demonstrate this premise, but this will do for the video. We want to look at alignment, okay? That's rule number 1. You want to have good alignment. If you look from the front and you look from the back, you can see good alignment in the spine. There's no shifting side to side. If there is, that can put stress on the disc and the joints and irritate the nerves. So we want to have good alignment up and down. From the side, you want to have a good lordosis here, okay? You want to see a nice lordotic curve. If it's too far forward, too far back, or if it's too little or too much, that'll put biomechanical stress on the disc and joints, and that could lead to a problem later on. On top of alignment, which I put as rule number 1, we want to have good intersegmental range of motion. Now notice I said intersegmental range of motion, because you can have good range of motion, and you need good range of motion, don't get me wrong. But you could bend over and touch your toes and bend backward and do all that kind of testing range of motion, and people say, oh, he's fine. We like to test you intersegmentally. We want to make sure each one of these vertebrae, these 5 vertebrae on average that you have in the low back, are moving properly. Okay, side to side, front and back. There's no glitches or hitches in the actual movement. If I bend over and touch my toes, I might have 2 or 3 of that vertebra moving a little bit too much so I could actually reach that position, and 2 of the vertebra or 3 of the vertebra, or whatever the case may be stuck in a certain position. We call it fixation, or a chiropractor will call it a subluxation fixation. And if that's the case, if you're doing that all day long, so your 2 vertebrae right here, say L4 and L5, are not really participating in the movement like they should, and when you bend forward, bend backward, and rotate side to side, they're kind of stuck in that position, and it happens from usually a disc that's bulging out or degenerated, or sometimes the capsule ligaments get tight in there, so that can cause the joints to locking up. So it could be a muscular imbalance, and we'll get into that in a moment. So if that happens year in and year out, you could develop a degenerative process in there and you can have a problem. If your joints move too much, in other words you have an injury, and all of a sudden there's a lot of wear and tear in there, you could see it on an x-ray, and we take x-rays in the office to kind of rule out degeneration and see if you have stenosis or even a disc problem. You can see the degeneration in there builds up from wear and tear. Okay, we mentioned number 3 would be stability, muscle stability. We want to make sure your muscles are like a guide wire. Okay, on both sides here, in front and back, they should be working together to hold this spine in place. So when I bend over to tie my shoes or to just lift a weight, I want to make sure my muscles are firing properly and there's not an uneven balance from side to side, because as I'm participating in the movement, I could have a problem there and I could get a pull or even a subtle tug out of alignment. People don't even realize this. They wake up with a stiff back, or they can't move one side more than the other. Could be from an auto accident or a sports injury or just daily stresses. That can cause a problem down the line because that's an imbalance. What we do with athletes, and we do with a lot of our patients, we'll have them walk down the hallway or walk on the treadmill that we have in this room. And what happens is I look side to side to make sure they're walking evenly. If their muscles are not firing properly and one side is pushing more than the other, it can cause wear and tear, once again, to the disc tissue. Now to explain a little bit more about the disc tissue, I'll use another model here. This is a motor unit that we use in the office, okay? And like I said, this is the front. It's lined up pretty good. In the back, you can see the spinous processes are lined up here. Now, these are just 2 vertebrae. Okay, you have 2 bones, and you have your intervertebral disc here, which has 2 components. You can see right here. Now, there's no discoloration, and you can see there's a good size lumbar disc here. I like to call that fat and happy. There's still plenty of water in here. Still has a lot of compression force when I push down, and it has good range of motion here. If you get older, or you don't take care of yourself, or you're in an accident, you could actually lose the water content in here, and you could actually lose your range of motion. If you can see this vertebra, now this is hypermobile because we don't have the nerves, we don't have the arteries and veins and all the vessels in there and the fat that actually you could see within this area here. We just don't want it for demonstration purposes, and it gets kind of messy a little bit. So as you move up and down, that's pretty normal. Range of motion is pretty good. I get an accident, or I'm sitting at a desk all day, or my back kind of gets stiff and tight and I don't really take care of it. This will not move as good, and what happens, it will wear away the joint and you get a degenerative disc disease. Okay, so 3 things I like to focus, and this is the take-home message. You have to have good alignment of your spine. You have to have good intersegmental range of motion as well as good full range of motion. And you have to have stability with your muscles. You hear the term core stability with the low back. Well, that's correct. You have to have your muscles working properly side to side, and they have to be stable so you can go through the motions you do every day. In the office, we evaluate that. We do a lot of muscle testing in the office. We do a lot of postural evaluation, and we want to see where we're at. Once we can get that picture of where you're at, if you have good alignment or you have faulty alignment, if you have good stability or you have faulty stability, if you have good range of motion or maybe you're lacking range of motion, then we can kind of grade you on where you're at and what we can do to help prevent this. Because you want to make sure you take care of these components before they become aggravating disc problems or sciatica, or even worse, stenosis, which would be basically the spinal cord right in here. You're starting to degenerate so much where you don't even have a lot of room for the spinal cord. And once it gets to that problem, it's a little tougher to deal with, and you don't want it to get to that stage. So just always remember, don't wait till it's the last moment to see your chiropractor. Okay? Yours in health.